Hi, I'm Lisa Costa-Bir and we're here at the 8th Annual NIIM Symposium 2023 in Melbourne. Joining us today is Dr. Brad Leech. Welcome to FX Medicine, Brad. It's great to have you here.
Lisa, it's fantastic to be chatting all things functional dysbiosis and pathogenic infections.
Of course, and you are the best with all of this. Now, you're presenting at the conference this weekend. Can you give our listeners a little insight into your presentation today?
Definitely. So I'm going to be talking all about dysbiosis, but doing a deep dive into the similarities and the differences between a pathogenic infection, a overabundance of a pathobiomes, and functional dysbiosis. And what I really want to portray to the audience and to the practitioners in the room is how we go about assessing each type of dysbiosis, and then also the management methods that we want to employ in clinical practice depending on the type of dysbiosis seen.
Very interesting. Now, for those of us that don't know, can you explain to us a little bit about what a pathobiome is?
Yes. So a pathobiome is a microbial species which is associated with a negative disease outcome. So it's a species that we see higher in Crohn's disease or IBS compared to a healthy individual. Whereas you've got a pathogen, and a pathogen is a microbial strain that's causative of disease, such as C. diff infection. Now, something to note here is a lot of practices actually get confused between the difference between a pathogen and a pathobiomes. A lot of the times in clinic, when talking with patients or even with other practitioners, they refer to a pathobiomes as a pathogen, when in fact they're very different in relation to how they present and then also how you would go about treating them.
Okay, very, very interesting. So what's something you can share with us for those of us that can't see your presentation today that would be really relevant for us to know?
I would say my treatment objectives for the different types of dysbiosis. So I'll start with a pathogenic infection. So if someone had a true pathogenic infection, the treatment objectives here is to eliminate the infection, to protect the microbiome, and support overall gut health. When it comes around to an overabundance of a pathobiomes, we want to increase commensals, so they are our good bacteria. We want to decrease the overabundance of a pathobiomes, and of course support with the environment within the gut. When it comes around to functional dysbiosis, we want to mitigate the effects that some of these microbial metabolites can have on both gastrointestinal and systemic health, while also trying to reduce some of these microbial metabolites if they are out of range, and of course supporting the environment within the gut.
Excellent. Now, Brad, do you have a favourite gut supplement that you want to share with us? What's your fave?
I love all different supplements for when it comes around to the gut. It comes down to the individual and how their microbiome is. So unfortunately, I don't think I could say glutamine's my favourite or PHGG is my favourite, because it depends on the individual. It depends on who is there in their microbiome, what are they doing, and what am I trying to achieve? So it's really about trying to find the right intervention based on that individual. But if I was to broadly identify a group of interventions, it would be prebiotic fibres. I love my prebiotic fibres because they are there to feed up and change the microbiome.
Fantastic. Now, Brad, you've recorded a podcast with me, which we released earlier this year on all things intestinal inflammation. So don't forget to check that out if you haven't already. And we've got a few in the pipeline, including one with our other ambassador, Emma, on antimicrobial herbs. Where else can our audience connect with you, Brad?
They can find me at drbradleech.com, where I've got a variety of different educational events, all on gut health and autoimmune disease.
Our favourite. And we've got one coming up soon in the pipeline on autoimmune disease too, so definitely check that out when it comes out. Thanks everyone for joining us. Don't forget to check us out on your socials and visit our website for all our infographics, articles and podcasts. I'm Lisa Costa-Bir. We'll see you next time.